My first guest to start us off is Dr. David Alexander, who is an ENT with the Lexington Clinic. And I said sleep apnea. Tell us, what that is, what the symptoms might be.
Absolutely. Thank you for having me. So sleep apnea affects millions of Americans. The most common symptom is snoring. And then basically sleep apnea is where you don't get enough oxygen at night when you're trying to breathe. And that can lead to other health issues, being tired throughout the day, fatigue, witness pauses in breathing at night by partners are the most common symptoms from it.
Because you mentioned snoring, but not all snoring sleep apnea?
Correct. There are people that snore that do not have clinical sleep apnea. Clinical sleep apnea is associated with dropping your oxygen levels at night, in addition to prolonged pauses in your breathing. So yes, there are people that snore that do not have sleep apnea itself, although snoring is very much associated with sleep apnea.
How do you make the diagnosis?
With a sleep study. There are traditionally two ways to do that. You can either come into a sleep lab and spend the night with a technician there helping doing the test with you. We also do a lot of home sleep studies now. Those have gained popularity in recent years, where basically you use some equipment at home, monitors that you wear for a couple nights in your own bed, obviously much more convenient for the patient, and still very accurate tests to diagnose the sleep apnea.
So once you've made the diagnosis, there's treatment options out there. But let's talk about the newest one, or at least to my knowledge, it's called Inspire. So tell me about that.
So Inspire is a surgical implant. It looks very much like a pacemaker. It goes over your right chest wall, and it works by stimulating the nerve that moves your tongue muscles forward and back. Part of sleep apnea is the tissues of your throat falling back and obstructing your airway, preventing you from getting that breath in at night. And this device works by basically stimulating some of the muscles in your throat to prevent that obstruction from happening when you're breathing at night.
Now you brought one with you there. It's a small implanted under the skin.
Correct. So this is the actual generator. This goes over your right chest wall. And then there's an additional wire that comes out from this. It runs under the skin into your neck to where it wraps around the nerve that moves those muscles.
So cosmetically you can't see that?
Correct.
And you operate it remote control?
Yes, so there's a remote control. It is only on at night when you're sleeping. There's a very simple on-off, a couple other buttons that you utilize to program it. But yes, you use the remote to turn it on and off at night.
So who's a candidate for that?
So you have to have at least moderate to severe sleep apnea. You also have to have tried CPAP, so it's important to understand that CPAP is still the best therapy that we have for sleep apnea. So we really reserve these therapies for folks that are intolerant of CPAP, which can be up to 50% of patients with sleep apnea, so that's a large number. So you have to have tried CPAP before. There are also some weight restrictions on it as well. The guidelines are available on the Inspire website if you're curious about if you would potentially qualify.
Now you mentioned CPAP, 50% of the people can't use CPAP, but you've had pretty good results with Inspire.
Correct. So this works very well for the right patient. The 90+% of patients tolerate this better than CPAP. And the clinical outcomes with it are better than a lot of the other traditional surgeries we had for sleep apnea, such as removing patients' tonsils.
And some of that surgeries can be a big surgery. Inspire would be a much better option if they're a candidate.
Correct, because we're not doing any surgery in your throat at all with this. It's all just externally under your skin. The recovery time after this sort of surgery is much easier than some of the traditional surgeries that we had available for obstructive sleep apnea.
One quick question though. Does weight loss itself, can that fix sleep apnea?
It can. Weight loss can definitely fix sleep apnea. But there are a lot of people who are normal weight and still have severe sleep apnea. So while the two are correlated, that doesn't necessarily apply to everybody.
Well, thanks for coming in. Thanks for telling us about it.
Absolutely. Thank you for having me.
And if you're snoring and think you might have sleep apnea, Dr. David Alexander can help.